Have you ever been told that you're too flexible? This actually might be a sign of hypermobility. Hypermobility syndrome simply means that your joints move beyond the typical range of motion. Think dancers, gymnasts, or even dedicated yogis. For some people, that extra motion is no big deal, but for others, it can lead to joint discomfort, muscle tightness, or feeling of instability. To help identify hypermobility, clinicians often use a quick screening tool called the Beighton score. It looks for how your fingers, your elbows, your knees, and your spine move to see whether those joints go beyond what's expected. Austin is going to go through these tests with you in the next few videos. And the key with hypermobility is not stretching more. It's building strength and stability so your joints feel more supported, controlled, and confident.
So the first test, a test for hypermobility. Just going to lay your hand flat on the table. And what the clinician will do is they'll overpressure your pinky digit, looking to see if it goes above about 90 degrees backwards this way. And you do this bilaterally. So the next test for hypermobility is going to bring your arm straight out, palm face outward, and you're going to see how far you can bring your thumb back towards your arm here. And again, you're going to want to do this on both sides. So another test for hypermobility. So you're just going to bend forward at your waist, keeping your legs straight, and seeing if you can put your palms on the floor. The next test for hypermobility is we're going to have a patient bring her arm straight out in front of her, and then we're just going to passively extend it, looking for it to go greater than 10 degrees. And again, you do this on both sides. The next test for hypermobility is going to be on the lower extremity. We're going to be looking for knee extension. So what you want to do is you're going to passively look for that knee extension with overpressure. Again, just like the arm, looking for greater than 10%, and you do both sides.
Have you ever been told that you're too flexible? This actually might be a sign of hypermobility. Hypermobility syndrome simply means that your joints move beyond the typical range of motion. Think dancers, gymnasts, or even dedicated yogis. For some people,